Hospitals are places we go to get better, to heal, and to find relief from our ailments. But sometimes, the most unexpected things happen inside those walls. You walk in with the hope of getting your painless life back, but if the doctor is incompetent, well, things can go horribly wrong. It is possible that you go in for a simple procedure but come out with a condition that changes your life forever. Because that's exactly what happened to this young man. He went in for what should have been a straightforward spinal surgery, but tragically, he never walked again after that. So, what went down in that surgery room? What did the doctor do? Or maybe, what did he fail to do? Let's find out. This is the story of Brian Jefferson, a man who loved life. He worked as a butcher in Eastmoor, a job he enjoyed and was really good at. People in the town knew him well because he was a friendly person who was always smiling at others. Brian was also a family man. He spent weekends with his sons, where he would go with them to their rugby games. He also loved taking long walks in the moors. His life was busy, but fulfilling. It was totally centered around his work, family, and simple pleasures. Then one day, Brian started to feel something was not right. He started feeling back pain and a strange tingling sensation in his arms. At first, he thought it was just because of his physical demanding job, and he had strained his muscles, but the pain did not go away. It got worse and worse, and the tingling turned into a constant annoyance. Soon, his arms started to go numb for minutes. This is when he realized that he needed help. So Brian decided to see his doctor. His general practitioner suggested that Brian get an MRI scan of his back to see what's going on. The scan showed that Brian had a prolapsed disc in his spine. This means one of the discs between the bones of his spine was damaged and pressing on his nerves. This diagnosis came as a shock for Brian. The pain and discomfort he had been feeling now had a serious explanation. His doctor told him this condition could cause a lot of pain and numbness, and could get worse if not treated properly. Brian was then referred to a top neurosurgeon for further evaluation. After looking at the MRI results and hearing about Brian's symptoms, the surgeon recommended surgery to remove the prolapsed disc. Now, for Brian, this seemed like a great solution, a way to get rid of the pain and go back to his normal life. But in reality, this was the first big red flag. You see, today, with all our advanced medical knowledge, surgery should be the last option for treating a prolapsed disc. Many cases can be managed effectively with physiotherapy. For someone like Brian, physiotherapy could have been enough to relieve his symptoms. It would have helped him by strengthening the muscles around the spine, improving flexibility, and reducing pressure on the nerves. With regular sessions and the right exercises, Brian's condition could have gotten much better without surgery. Physiotherapy would have also allowed Brian to stay active while managing his pain and improving his mobility. The treatment would have involved personalized exercises and possibly some lifestyle changes. These non-invasive methods often work well and help people return to their normal activities without the risks that come with surgery. But the surgeon chose to go with surgery. This is where we got to know that the surgeon did not act in Brian's best interests. Surgery is an option that benefits doctors, but it's not always the best choice for patients. And if we talk about Brian's case, the surgeon should have referred him to a good physiotherapist instead of asking him to get the surgery. This would have made all the difference. His life could have turned out very differently if he had been given a chance to try non-surgical options. In fact, with physiotherapy, Brian might have seen improvement within a few months. Unfortunately, that's not how things worked out for Brian. Finally, the day arrived and Brian Johnson went into surgery. He trusted the doctors because he believed that after the procedure, he would be back to his old self, to a life where he would cheer at rugby games and enjoy walks in the moors. The surgery that the doctors decided to perform on him is called a discectomy. In this surgery, a part of a herniated disc is removed from the spine to relieve pressure on the nerves. Normally, a discectomy is simple. The surgeon makes a small cut in the back, moves aside the muscles, and removes the damaged part of the disc. This helps to relieve pain and restore movement in the back. Patients usually recover well in a few weeks and can return to their usual activities. They just need some days of rest and rehabilitation. But for Brian, something went terribly wrong. During the surgery, a blood clot formed near the site of the operation. This blood clot put pressure on Brian's spinal cord. Now, this is where the hospital showed incompetence. It took the hospital staff 24 hours to discover the clot. They ended the surgery, stitched him up, and told the family everything was fine, while this deadly blood clot was pressing on his spinal cord. By the time the hospital performed a scan and identified the problem, it was too late. The clot had caused severe damage to Brian's spinal cord. The hospital performed a second surgery to remove the clot, but the damage was irreversible. Brian woke up from the surgery with no feeling in his legs. When Brian woke up, he felt confused and scared. He couldn't move his legs or feel anything below his waist. The doctors explained what had happened. The news was devastating for him. Brian, who had been active and full of life, was now paralyzed from the waist down. He was told that he would have to spend the rest of his life in a wheelchair, unable to walk, run, or even stand on his own. His life had changed forever in a way he had never imagined. Life after the surgery became incredibly hard for Brian. He suffered from constant leg spasms. If that wasn't enough, he had to undergo several more surgeries to remove excess bone growth from his hips. Simple tasks turned into challenges for him. His family also struggled to adjust. They had to make their home wheelchair accessible and find new ways to support Brian emotionally and physically. The pain of losing his mobility and independence was so great, but Brian was determined to find some form of justice for what had happened to him. Brian decided to take action against the doctors and the hospital. He felt they had wronged him and wanted to hold them accountable for their mistakes that had cost him so much. He decided to sue for medical negligence. Unfortunately, he faced struggles here as well. 4 different law firms looked at his case and turned him down. They were not ready to help him due to the surgeon's high reputation and the complexity of the case. They told Brian that it would be nearly impossible to prove that the surgeon was at fault and that the blood clot was caused by the surgery. Even after being rejected by 4 firms, Brian did not give up. He continued searching for legal help. Finally, he found a firm that was willing to take on his case. It was the Firm Express solicitors that took his case. They worked tirelessly to build a strong argument for Brian. They decided to prove that it was the surgeon's actions that led to Brian's paralysis and that the hospital's delayed response made his condition worse. In the trial, Express solicitors argued that the surgeon should have considered a better approach for the surgery. For example, the doctor should have approached the disc through the chest instead of the back. They presented evidence showing that this approach has worked for many patients before and should have worked for Brian. They also pointed out the 24-hour delay in diagnosing the blood clot. They said that this delay was a clear sign of negligence. The hospital staff should have acted quickly when Brian reported numbness and loss of movement. Immediate action could have prevented the permanent damage to his spinal cord. The defense tried to counter these claims by talking about the surgeon's high reputation and the inherent risks of any medical procedure. They argued that blood clots are a known risk and that it was impossible to predict or prevent this complication. They also claimed that the delay in diagnosis did not affect the outcome as much as because the damage might have been unavoidable. Despite the defense's arguments, Brian's attorney kept fighting for justice. He brought in medical experts who testified that the surgery could have been performed through other methods. These experts explained how a different approach could have led to a better outcome. They also confirmed that the delay in diagnosing the blood clot significantly contributed to Brian's paralysis. The trial was tough. Both sides presented complex medical details. However, Brian's legal team managed to keep the focus on the core issue, the preventable mistakes made by the surgeon and the hospital staff. After weeks of intense legal battle, the court finally ruled in Brian's favor. The The judge agreed that the surgeon and the hospital had failed to provide the standard of care Brian deserved. They also acknowledged that the surgery was not the best option and that the delay in diagnosing the blood clot was a big mistake. Brian won a compensation of 1.9 million euros. Using this money, Brian can now cover his medical expenses, adapt his home for wheelchair access, and provide for his care needs. While no amount of money could restore his mobility, the verdict gave Brian a sense of justice and financial security. How do you think we can make sure that medical professionals always prioritize patient safety and explore all possible options before resorting to invasive procedures? Share your opinions with me in the comments below. And before you go, make sure to give this video a big thumbs up. Don't forget to subscribe to my channel for more shocking stories. Thanks for watching. See you next time.